So, hello guys. So, the topic that I shall be discussing today is PPH. PPH means postpartum hemorrhage, right? Okay. I shall discuss this topic very briefly, only the points that are required to be remembered, and from that part only most of the questions will be solved. Okay, first of all, we need to know the definition of PPH. Definition means any bleeding, any bleeding which occurs from the female genitourinary tract after delivery, right? By any bleeding, I mean it can include both traumatic bleeding, or it can include uh, either traumatic or uterine bleeding. Either it can be uterine bleeding or traumatic bleeding, or both can be involved. Now, after definition, we come to the types of PPH. So, types. So, it can be broadly classified into two types based on duration. Okay. Number one is primary PPH, and number two is secondary PPH. Right? Okay. So let me write it properly. Primary PPH. That's how it goes. Okay. This is based on the duration. Okay. So what is primary PPH? It is if the bleeding occurs from delivery till 24 hours. Okay. It is known as primary PPH. And if the bleeding occurs from 24 hours till 12 weeks post delivery, then we can call it secondary PPH. The most common cause of primary PPH is atonic uterus. What is atonic? Atonic means loose, relaxed, soft uterus. And the most common cause of secondary PPH is retained bits of placenta. Retained bits of placenta. What does this mean? This means that after delivery, some part of the placenta is remaining within the uterus, which is causing that bleeding. Okay, this is based on duration. And another is based on the uh, amount of blood loss. It can be classified into either mild or moderate or severe. So what do we mean by mild PPH? Mild PPH is if the blood loss is uh, between 500 ml to 1000 ml, and moderate means if the blood loss is between 1000 ml to 2000 ml, and severe means more than 2000 ml. So this 1000 ml is known as significant blood loss. Okay, so this was asked as a question that how much amount of blood loss is considered as significant. It is 1000 ml. Now the most important part, that is management of PPH. This is the most important part. So management of PPH. So first of all, if the person is having PPH, then firstly we shall do abdominal palpation. Okay, so abdominal palpation. We can get two findings: either the uterus can be atonic, that is, it is relaxed, or the tonicity of the uterus is maintained. So tone is maintained. Okay, so two types of findings can be there. So the most important is if the uterus is atonic. So how will we manage that? First of all, we shall do uterine massage. Okay, this is number one, uterine massage. Number two, we give oxytocin infusion. So oxytocin infusion, how much? It is to be given almost 40 to 60 ml. 40 to 60, 40 units. It can be given up to 40 units for 40 to 60 minutes. Okay, this oxytocin infusion can be given. Next, we can give injection methergin. This is given 0.2 mg IV. Okay, so it is given every 2 to 4 hours. Next, uh, we need to keep blood ready for blood transfusion if required. So blood transfusion. So first, after finding that the uterus is atonic, we shall do these four steps. First of all, we shall do uterine massage, then we shall give oxytocin infusion, then we have to give injection methergin, then blood transfusion. After that, if the uterus is still atonic, then we need to give injection carboprost. Injection carboprost, and the dose is 250 micrograms IM. We have to give it IM, and we can give it up to 8 doses. Okay. Next we have uh, misoprostol. Misoprostol 800 milligrams. No, 800 micrograms. Sorry, 800 micrograms. We give parectally. Okay, so this is the second step of the management. So after following this first step, if there is bleeding, we proceed to the second step. We give injection carboprost 250 micrograms IV into 8 doses, and after that we give misoprostol 800 micrograms per rectally. After that, if the bleeding is still continuing, we give uterine tamponade. What is uterine tamponade? We give it by Bakri balloon or we can use condom catheter. Bakri balloon is not easily available, so we use condom catheter mostly. So if this is the uterus, we inflate the catheter like this, and this will compress the uterine wall and stop the bleeding. Okay, so even after this, if the bleeding is not controlled, then we go for definitive devascularization. This is surgery. Okay, so what are the vessels that we ligate? So the vessels that we ligate are in order of, first we ligate uterine artery, then we ligate ovarian artery, then we ligate the anterior division of internal iliac artery. Okay, this is how it is managed. And even after that, if the bleeding is not controlled, we go for hysterectomy. Even after that, if the bleeding is not controlled, we go for hysterectomy. Okay, so this is how it goes. This is the complete flowchart. Now this is happening when the uterus is atonic. Now if the tonicity is maintained, then we first do exploration of the uterus, and if we find that if the bleeding points are there, we first need to apply hemostatic sutures in the uterus. Many sutures are there, billion sutures and others. It is applied like if this is the uterus, and if the bleeding points are here, then the sutures are applied like this. So this is how the hemostatic sutures are applied. And after that, if there is uterine rupture, then we go for hysterectomy. So this is the complete management of PPH. So first of all, we need to do abdominal palpation. If the uterus is atonic, we need to follow these steps. If still the bleeding is not controlled, we need to follow these steps. After that, if the bleeding is not controlled, we need to go for uterine tamponade. Then we need to go for devascularization surgery, and these are the order of arteries in which we ligate. And finally, we go for hysterectomy. And if the tone is maintained, then first we go for exploration and we locate the bleeding points, and there we apply hemostatic sutures in the uterus. After that, if we find that there is uterine rupture, then we go for complete total hysterectomy. This is the, in short, the management of PPH. Most of the questions will be solved from this part. Thank you very much.